Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to new medical coders when working with veteran medical coders. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if you have started your first job in medical coding, there are some things that you need to know about working with veteran coders. Now, some of these veteran coders have more experience than others, and some have more education than others. But here's the thing, there is an unspoken rule about etiquette in this industry. Some things that you should know, okay? I have been in this industry for 15 years, so I've seen many a brand new coder. I've trained many brand new coders. And here's some of the things that I want other new medical coders to know, right? If I had a chance to talk to somebody who's new before they got in. The first things first, if you are receiving training from your lead or from somebody, your supervisor, make sure you have a pen and paper with you. This is not a negotiable thing. Oh, I can remember. No, you can't. Because trust me, there's going to be plenty of things that they're going to throw at you when you first start, because it's not just the coding. Remember, it is also going to be that particular place's specific rules about coding, because sometimes they have other things that they need to add or whatever. Depending on the insurance as well. And there's also learning the electronic medical record. So make sure that you have a little notebook with you, even if it's a spiral notebook that you can get from the store, something to have all your notes in. That's the first thing I look for when I see a brand new coder, because when I see a brand new coder who's just there and just so happy to have a job, and then they just sit there with you and they start asking these questions, but they're not writing them down. And then when they go back to their desk, and of course they forget, and then they have to come back to me. It takes time, guys. It really does. And when you are receiving training from a seasoned coder, veteran coder, you're taking their time away from production, their time away from working on their clinic, their time away from doing what they are hired to do, right? And so training ends up becoming a secondary task, because there's always that other duties as assigned. And I'm okay with training. I love training. I have no problems training. However, I do expect the people who I train to bring their A game. And that starts with having a pen and paper in hand and writing down the answers to the questions that they're asking. That's what I expect. And I think that's a minimal expectation of, and it shows respect, because you're respecting that person's time. Right? That trainer's time. The other thing is, when you are brand new, that you're not going to sit here and ask questions that are just very easy to look up. Anytime you are going to a veteran coder with a question, you need to make sure that it's a really good one, and that you have done everything you possibly can to try to figure this out on your own. Because if you don't, it's going to show real quick. And these veteran coders are not going to want to help you. And there's a lot of them out there that are like that. They have that attitude of, nobody trained me, so I'm not going to train you. I don't think that that's right, but at the same time, everybody does their own thing. Now, I am always willing to help, but what I am not willing to do is to waste my time with somebody who is not paying attention, who is not writing things down, and who has no regard for my time. Okay? Because that's disrespectful when you do that. So just make sure that you're always trying to make sure that you figure it out first. And if it is something that is procedure code related, or if it is just something that is with a diagnosis, make sure that you utilize the internet. There's plenty of resources. There's also Coding Clinic and CPT Assistant that is out there to help kind of answer those questions. Because in CPT Assistant and Coding Clinic, you can put any subject in there that you want to, and all of the questions that have come up related to that particular topic will come up, in your search results, and then you'll be able to go from there and read and do your research that way. Veteran coders will respect people who do show that ability to be able to do their research like that, because that's not a common thing. Because a lot of brand new coders, they're told by the school, oh, it's going to be this way, and they'll train you, they'll teach you on the job. No, they won't. They'll teach you about the electronic medical record, because everybody uses different electronic medical records. But they always tell you this is not a training position. We are not training you on how to code. So if you are already getting in there and you manage to get in there by passing that assessment test and of course having your certification, that already shows that you're competent. So that's what they're going to expect from you. So again, it's okay to ask questions, but make sure that you have exhausted every avenue before going to them and asking them questions. Because there's nothing worse than that, than a brand new coder who runs back and forth and doesn't show any initiative to try to find the answer. Or if they're like asking a question, it's very simple. Even I don't want to answer very simple questions. But guys, it's not that hard once you start learning how to do your research. And I did the video a couple weeks ago now about my favorite websites to go to. You know, the internet is chock full of helpful websites for medical coders. And it's not just about the coding aspect. It's about understanding the disease process. It's about understanding the procedures, because that really helps you once you start coding to know, okay, what does this procedure entail? Or what does this diagnosis entail? Okay. And there's plenty of reference books out there. Optum has a lot of really great books. They're still on sale. I have to be very careful going to Optum because I always like to find all the references that I can, but there's a lot of really helpful resources specifically for coders. So that's something that you may want to invest in. Okay, guys, that's not something that's required, obviously, but let's just say, for instance, you get hired as a brand new coder in the OBGYN clinic. And you're thinking, okay, great, this is my first job and I'm going to be working at OBGYN. I know nothing about OBGYN, but I'm just excited because this is my first coding job. Guess what? Optum has the specialty specific book for OBGYN coding, and it lists all of the procedure codes along with all of the corresponding diagnosis codes that go with it. It also explains those procedures, and it also explains, like, you know, what all is entailed in it, and there's a lot of other helpful information that goes right along with it. So that would be something that would be a sound thing for you to do, right? That would be a wise investment for you, is to spend that $39.99 to get that specialty book, okay? If that's where you're assigned to work and like you want to get really good at it, you know, and that's maybe something that you could look at, especially if you're working on procedures, right? Major procedures, because that's what that book has in it. But again, there's a lot of really helpful information in those specialty books, and there's one for every single specialty. So if you do ortho, podiatry, urology, they're all there. And so even emergency department. So there's a lot of really good reference books there that I think will be very helpful if you wanted to invest something like that. And that's a small investment. You don't have to get the current year, 2024. You can get the 2023. And it's, like I said, it's on sale for $39.99, free shipping. Okay. So that's something that can kind of help you. I also do recommend that you review the coding guidelines. I know not the coding guidelines, but the chapter specific guidelines, especially for your clinic, wherever you're going. This is something that can help you when you are asking a veteran coder for help. You can say, look, I have this coder desk reference manual, or I have the coding companion for this specialty, and this says this, but I'm still kind of confused. That's impressive. To me, if I saw that, I would be like, okay, I have all the time in the world to help you, because that means you know how to do your research. You're coming to me with these tools, these advanced tools, that I would be like, okay, I'll do anything. I'll stop what I'm doing and help you, okay? Because that shows me you have initiative. And guess what? Whenever there's brainstorming sessions like that, guess who also learns? Me. As a veteran coder, I learn things too. So that's always a good thing. And it always makes me feel good when I can explain something to somebody that is like, oh, okay, yeah, now I get it. Like, it doesn't make sense to like a civilian, but to a coder, it makes a lot of sense. So brand new people kind of have to be brought into that, you know? So there's a lot of topics on that, on that kind of thing. But when it comes to something like that, that's what fires me up in a good way, you know, because I like that. I enjoy that. And of course, you just nerd out and you start talking about these things and it gets really deep. But You have to show that you're doing that, because the person who says, hey, Blue, I need your help again. I don't know how to do this. Okay, well, where did you start? What do you have? I don't know. Okay, well, what's going on? It's so confusing. Okay, well, what is confusing? All of it. Well, what is all of it? You know what I mean? Like, what are you specifically asking about? The diagnosis or the procedure, or what are we looking at, you know? And if you said to me, you said, Blue, I looked at this note. I see this diagnosis, and I think it's this procedure code. But the only reason I'm questioning it is because there's also this procedure code, and they're really close. So what do I do here? Now, that makes sense, right? Because you're showing me that you have already tried and you've attempted, and that's respect gaining to me as a veteran coder, right? When I see a coder doing that, a brand new one doing that, I want to see initiative. That's what I want to see, because anything less than that, I don't have time to help you. And especially if I just explained it to you and you're running back and forth asking me the same question again. This is why I say you have to have that pen and paper in hand. You know, there's a lot of competition in the industry. Coders can get very competitive. They can also get very defensive. And I don't say this to scare you, and it's not so that, you know, you can label all coders like this. But coders do tend to get defensive when it comes to their work, especially like if they're auditing you and you have something that is borderline right, but the veteran says, well, actually it's this way. And then you say, well, you know, I do have this reference and this says this, but what do we think about this? So it's not just, no, I don't want to be wrong, so I'm just gonna, you know, fight against whatever they say. You know, no, you need to understand why they are saying these things. So that's something that you have to really be prepared for. Now, not all auditors, not all supervisors, not all lead medical coders are as evolved. Some of them will be very stubborn, and they may say, well, it's this way, because I said. No, there's no because I said. It has to be supported. And anything that any kind of guidance that they give you, it needs to be supported. And that's doesn't matter if you're brand new or if you're a veteran as well. If you don't fight back when it comes, and fight back in a professional way, obviously, but if you don't fight back on your stance of like, why did you get this? You know, or if you don't tell them, hey, I found this coding clinic, I found this CPT assistant, and it says this, and the guidelines say this, so that's why I selected this. You know, sometimes a veteran may say, well, fine, you know, I'll just give it back to them or whatever. You know, and they may be upset about it, but they'll get over it. But you have to learn to be sure to stand up for yourself. You cannot just go along to get along. And that's in the ethical standards of coding as well. The AHIMA standards of ethical coding. It talks about, I'm paraphrasing obviously, but don't just go along to get along, okay? And we are in a serious business. This is health information. And think about all the things that you're coding that is going into this patient's record. And this patient is going to be taking this specific record with them everywhere. And so all the codes that you select is going to affect that patient on how much money they spend, and you know what these doctors are seeing when they get their notes at another facility. They're going to know, okay, well, the coder selected this, and you know, this is what the documentation looks like. And then as you have more time in the field, then you'll be able to start working with your providers on, you know, making sure that they have full and complete documentation. So those are responsibilities that we have as coders. It's not some willy-nilly project. Oh, I can do this and I can, no. It's very serious, all right? And it does take you to evolve personally and professionally. And that personal part is, okay, I'm going to show up here with a good attitude. I'm going to do my part, and I'm going to make sure that I ask questions when it is appropriate. I'm going to show respect to the people who have been in the industry and who are there to support me and help me. You know, I'm not going to take advantage. Don't take advantage, guys, because there's a lot of people who will take advantage of veteran coders and say, well, I don't understand how to do this. Can you do it? No, no ma'am, no sir, I don't think so. And so that's going to get you out the door really quick. So it's not something to be playing with, because there's coders that will, that do have experience versus people who don't have experience. And you want to make sure that if you don't have experience, you're doing everything you can possible to show why they hired you and why you were a good choice. Okay. Now, again, there may be times when you get into that particular clinic or hospital or specialty or whatever, and the coders may have already their little group. And sometimes it may take them a little while to warm up to you, that's just what it is. I talk about before, when I went to my second position, well, when I went to my second position, I came here to my forever home. When I got here to my forever home, the clinic that I was put in was inpatient professional services, which is a professional fee coding. And the two girls that were in there were very buddy, and I was not allowed in their group. And they made it very clear that they weren't happy with me being there. And so I had to be stubborn and say, okay, whatever, I'm not here for you. I'm here for work, and I'm just going to go ahead and do my thing. And it wasn't until one of the girls made it very difficult for me that I went to my supervisor and I was like, okay, no, I'm going through too much personally to be coming here and dealing with this. This is uncalled for, but I went through it. I went through those paces of people, trying to, be cliquey and, but after I went to my supervisor, everything settled down, and we were able to work it out, me and this girl. And it wasn't an easy time. But then again, people nowadays are very sensitive, and everything is about their feelings, and they want to just run the first time they get yelled at. You will get yelled at. That is an inevitable part of working anywhere. That's not just coding. That's working anywhere. And should you get yelled at? Obviously not. But at the same time, it happens because we are all human. All right. And so that's something that you have to learn to toughen up. Because like I said, there's a lot of thin-skinned people in this, and even studying. There's a lot of people who comment who say, oh, you're mean. It's not mean. It is meant to set you up for success. So that way you can be prepared, and you're not going to be out there and all of a sudden you're just shocked because, people are just, they're not going to help you. Okay, well, it's not personal. They just have quotas that they need to do. So if you feel like you're a very sensitive person, there's TED Talks. There's lots of resources out there on how to develop a thicker skin, how to be stronger, because that's ultimately what it is. People need to build up that professional strength so that they're not taking everything personally. And that's a lot of times what happens, right? Is that when people are asking questions and, somebody finally gets annoyed with them because they've been asking questions and they're not doing their research, and then they want to sit here and cry because no one wants to help them. What are you doing to help yourself? Right? So that's why, that person versus the person who is showing initiative, who is not taking things personally when people are upset, and maybe they get snapped at because they just got yelled at by their boss, or they had an attitude from their boss, right? And all of a sudden you show up and you're trying to ask a question and they snap at you because somebody just snapped at them. So you saying, okay, that wasn't on me. That's not me. I just showed up. So I have a question, but that's okay. I will go someplace else, or I'll look it up. I'll try to find somebody else who can help me, and not taking it personally. Because the person who's taking it personally would be like, that person had an attitude with me and they yelled at me. Is it right? No. Should it happen? No. But it happens, guys. And it's all about personal responsibility and how you're handling those attitudes and that pushback, right? You have to be strong, my people. You have to learn to build those strong characteristics. If you hear anything I say in this video, learn that not everything that these veteran coders are going to say to you, the attitude they're going to have with you, the willingness or the not willingness to help you, it is not personal. It is not personal. It is up to you on how you manage your feelings and yourself. If you know that that person is not going to help you, don't try to keep going back to them and aggravating them and saying, oh, well, no. Then you say, okay, I'm going to pick myself up by the bootstraps and I'm going to keep going and I'm going to figure this out. I have had an instance. It still kind of makes me laugh because I had been put into, I had left a supervisor. I left a supervisor. And this supervisor was assisting my new supervisor with clinic assignments. So she picked the one clinic that she knew I had never done, which was same-day surgeries at the time. And so she had been telling people, well, people should be careful what they ask for as far as like leaving my team. Oh, okay. Well, I left your team because it was not a good environment and it had been a long time of dealing with a not so good environment. And so going to this new supervisor, I'm like, hey, I'm fine. I can take on anything. I always have that in me too, as far as like, I can take on anything. And that's just the way that I am. If you want to throw something at me, okay, fine. Let's see how I can fix this. So all of a sudden I get my new clinic assignments, right? And I'm under this new supervisor and I'm so excited. And I'm like, okay, finally, good. I can finally get back to the business of coding. I don't have to have a micromanager on me. This is perfect. And so my new supervisor says, oh, you're going to do same-day surgeries. You're going to help out. I was like, oh, man, and I was like, oh, yeah, okay, cool. No big deal. And I'm thinking inside, I got to figure this out. I got to figure this out. So rather than run back and forth to my supervisor, what did I do? Hello, Google. And I started being able to look things up. I started doing a lot of research and I started figuring it out. And I did all that without breaking a sweat in front of my former boss. So that's the thing. If I would have been so thin-skinned, I would have been like, oh my God, everybody's against me and I can't do this and it's just so hard. That person would have fell apart. Not me though. And that's what I want to share with all of you. You don't have to be that person that falls apart because something gets thrown at you that is supposedly difficult. Anything can be figured out. Trust me, anything can be figured out. When you pass a certification exam, it says that you're competent in any specialty. In any specialty. Because they test on all the specialties. And so that's why it's just a little bit of, figuring it out. And that's all it takes. And so I just want you all to know that you will encounter wonderful people in this industry. Very supportive bosses. Jessica, my first real supervisor, Jessica, who is a fantastic medical coder. She is the best supervisor I've ever had. I learned so much from her. And of course, Laura, who when I got here was my first supervisor, an amazing woman, very strong. And I learned a lot from her about being strong and toughening up too. And so when you learn from positive people like that, it can carry you your whole career. And of course, when you think about like all those other people that, may have been mean to you or whatever, they don't matter. When it comes to the coding, that's what it's all about. And then when you think about why you're there, that's the other thing that you have to think of too, especially if you're in a place that's kind of giving you a hard time. Think about why you're there. It's for the providers. It's for those patients. That's why you're there. And so that you have to do your best to help them. Because it's not about them, your other coworkers who may be giving you a hard time. It's about those providers. It's about those patients. And I say that, and again, I repeat, because I want y'all to hear me when I say these things. Build your personal strength. It will go a long way. And when you realize, guys, it took me a long time to figure this stuff out. But when you realize it's not about you, it's about that person, and their reaction to you is on them, that has nothing to do with you, that's when you start really advancing to a higher level of knowledge and readiness in life. Because you're not worried about all these fools out here trying to make things difficult for you. You learn to find better ways of doing things. You learn how those tricks go as far as like, okay, well, no, I can find this reference here. Or I listened to Medical Coding with Blue and I went on to optumcoding.com, not an ad. She says, not an ad. But I got one of those reference books, or I got the diagnosis for procedures, listen to me. The Coder Desk reference for procedures, Coder Desk reference for diagnoses. I got those so I can better understand. There's tools out there to help me. There's tools out there to help me. And I can still be a good coworker. I can still be a good employee. But I just need to make sure that I show that I'm taking initiative. That's it. And then you will see the whole complete difference in how people treat you, and how they will respond to your questions, and how you, when you get into these brainstorming sessions on, okay, well, I saw this and I saw this, maybe you might be teaching a veteran something. You never know. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.